I don't know anyone that doesn't appreciate a good massage, but what about the babies? What about the infants, whether they're sick or whether they're well? Baptist has a wonderful infant massage program. Patty James, a registered nurse, they're here to tell us all about that. And like we were saying, adults, I don't think anyone doesn't like a massage. But I'm watching these moms back here with these babies, and they look like they absolutely love it. Is this a fairly new program that you have?
Well, actually, we've had it for 5 years.
Really?
And we've been offering it for NICU parents since 2000. And then we have private and group classes for well babies.
Let's introduce who we have. I've got Andrea behind me and Jake, who is 8 months old. And Amy, mom here, with Blair, who is
5 weeks.
5 weeks old. Wow. And actually, Blair was in NICU. And what's the advantage of massaging babies, especially at this stage?
Well, for infant massage with preterm babies, we found that it helps them to grow better. They actually had a 47% greater weight gain when they received positive touch through massage. We know it helps them to sleep better, to digest better. We can facilitate growth and development in a pretty powerful way, as you can see. And it does really give parents a way to communicate to the babies using a language that the baby will also understand.
Yeah, we heard Jake's language a while ago. He's kind of quieted down now. We were going to hook him up with a microphone. Yes. Now, is it a certain kind of oil or certain method that you teach in the class?
We actually use a cold-pressed vegetable or fruit-based oil. And it's edible, and if they put their hands in the mouth,
I've noticed the fingers going in the mouth.
But it also has nutritional value, too, that what we put on the skin, they'll absorb it into the body within about 30 minutes. The supplies are very simple. We just use a blanket. We try to look at the lighting, the temperature, that kind of thing in the room. Often we'll use music. But it's real simple, and it's something you can flexibly do in your home at your convenience.
So would you recommend this daily, once a day, a couple times a day?
Absolutely. As a baby less than 6 months of age, I'd recommend it daily. And then after 6 months, you can use it 2 or 3 times a week just to kind of keep that connection and help them grow. And
I know you'll go over this certainly in the program, but do you have them rubbing all their body parts or just certain limbs and areas that are stretching and growing? Because this age, they are growing so quickly.
We do teach a full body massage, even for the babies in NICU. What we teach the parents is to watch the baby's cues, and if the baby likes it or shows that they're having pleasure with the massage, then they'll continue to do it. If they are giving signals that they want to change, then we'll use a different kind of stroke, or sometimes they tell us to stop altogether.
What have you noticed besides weight gain between babies that have and infants that have gone through this and those that haven't?
Well, we use it a lot with kids that are colicky and have fussy baby syndrome, just kind of don't sleep real well and not real clear cues between sleep and awake states. It's very confusing for parents, and it's a great way of just kind of making that an easier transition. We know that it helps to strengthen muscles and to grow the...
proving that,
proving that. But it also strengthens the immune system, which is real important for babies in NICU.
Well, and of course, this is something that you've been able to use through your life, because even when kids get into the adolescent age and even older, they get the growing pains, and you've used this even recently.
Junior high students, yeah, I sure have. And I think because it is a communication tool, it actually keeps that foundation of early and continuing, communication, which is real important with your child.
Well, ladies, thank you very much for bringing your babies. First-time babies for both of these ladies, so I appreciate them being on. They're so well-behaved. Let's put some information up on the screen if folks are interested in how to get in touch with the folks at Baptist Hospital.
They can call the Women's Center Education Office, and that's 202-1717.
Wonderful, Patty. Thank you very much. Appreciate that.